Welcome. I'm Dr. Angela Mazza, a thyroid, endocrine, and metabolism specialist with an integrated practice in Central Florida. As our listeners know, my goal for this podcast is to define and demystify the thyroid gland and thyroid-related medical conditions. By providing information in an easy-to-understand format, I hope to help patients better understand the ways in which their bodies work and to help them thrive. Dawn Sheffield, my friend and co-host, is here with me for episode 23. Thanks for being here today, Dawn.
I would not have missed it. The more I learn about our guest, the more impressed I become. I feel so fortunate to be a part of this, and so are our listeners.
We're all lucky today that we're speaking with Jennifer Holkem about her own dramatic thyroid journey and about non-surgical options for maintaining thyroid health. Jennifer herself is a thyroid patient as well as an advocate for other thyroid patients on various platforms. A healthcare consultant to medical professionals too, and she hosts a podcast, Save Your Thyroid with Jennifer Holkem.
Jen is also an enthusiastic advocate for non-surgical thyroid treatment options like RFA, radio frequency ablation, to save the thyroid and the hormones it creates instead of removing it when that's really not necessary. Jen is also creating a community for thyroid patients, healthcare providers, and anyone wanting to learn about thyroid health. To focus on and to fund her RFA-related efforts, she's founded a nonprofit organization, Save Your Thyroid. We'll ask her all about that and about so much more.
Yes, we will. And I cannot wait. So, Jen, thank you so much for making time to be here with us today.
Wow, after that introduction, I feel like maybe somebody else should be speaking. Well, thank you so much for having me. It's such a pleasure to talk with both of you. And I'm just honored to be a part of what you're doing on this podcast, because I think the work that you've been doing, Dr. Mazza, is just amazing. So thank you for having me on today.
Jen, welcome. As a thyroid patient myself, your many streams of solid, fact-based information, including your podcast, are so interesting and so valuable to me.
Well, if you don't mind, I'd like to give a little bit of background on how Jen and I know each other. So a few years back when we started RFA here in the clinic, Jen interviewed me on one of her posts, and we just got talking. And then about a year after that, she actually came and visited our practice here. So we got to hang out, get to know each other a little bit, and just have been keeping in touch ever since.
You know, I think you were the first clinic I actually got to visit.
We've talked about RFA and thyroid nodules in a previous episode. I believe it was Thyroid Nodules 101, an intro to RFA. Remember that one?
Yes, I do.
But just to refresh everybody's memory, RFA, or radio frequency ablation, is a non-surgical technique for thyroid nodules. So nodules are masses within the thyroid. Nodules are really, really common. About 1 in 3 persons sometime in their life are going to show up with something along the line of a nodule. The nodules we get concerned about are the nodules that are cancerous, and really even less than 10% of nodules we biopsy are cancer or suspicious. But up until RFA, we didn't have a lot of treatment other than surgery for nodules that kept growing or were problems for patients. They were causing swallowing problems, compressive symptoms, and just didn't look great, or nodules that were overactive. So RFA, radiofrequency ablation, is a non-surgical treatment for thyroid nodules. RFA has been used for years for other types of masses, like in the liver, the prostate, even in cardiology. But it wasn't until 2002 that RFA came on the radar for thyroid nodules. So Dr. Beck in South Korea is really the forefather of RFA for thyroid nodules. And it's been used worldwide, but unfortunately, United States didn't get on the bandwagon until about end of 2018, 2019.
Wow.
Yeah, and that's when we started actually offering this option for persons with thyroid nodules at our office here. So we're so happy to provide this service, and we actually we're the only clinic in Central Florida right now offering RFA for thyroid nodules.
That's incredible. Well, Jen, would you like to tell our listeners a little bit about your own thyroid journey? How and when did you know you needed thyroid help, and what was that early process like for you?
Sure. So, one thing about me that's kind of weird, I guess, since I'm so into the thyroid, is the fact that my thyroid levels have always been normal. I've never had hypothyroidism, hyperthyroidism. My thyroid levels have always been perfect. I've had nodules for probably about 10 years, and they were first discovered by my OBGYN kind of by accident, which is a little bit scary to be honest with you. He stopped talking mid-sentence and said, "I think you have a lump in your throat." And then
Oh.
that led to a whole discussion about
And
thyroid nodules.
women, I think,
And I'll tell you, it's very common that women find thyroid nodules by going to their OBGYN because this is probably they're probably like the one doctor that a woman goes to see every year pretty regularly.
wow.
Right, right. Yeah, and so that started the whole journey towards discovering, was it cancer, and that was very scary for me. I didn't know that thyroid cancer is not usually as serious of a cancer as a lot of other cancers can be, um but I tried for a long time a lot of different holistic methods to try to shrink my thyroid nodules. None of them have worked, unfortunately. And so you ask when I started to realize I really needed help. It was probably about 2018. I had just finished a renovation, pretty massive renovation on our house that we had put on the market, and I just felt awful. And I suspect it's probably all the chemicals and paint and things that I had been exposed to had just been
Yeah.
working on my body in all kinds of bad ways, those endocrine disrupting chemicals. And I was exhausted all the time, had body aches and pains. I was always cold, and I had the worst brain fog, and basically had a lot of symptoms of Hashimoto's disease. I did a lot of reading about that back then. And over the years, my nodule had grown. It started off as several smaller nodules, but by then it had grown into kind of one big nodule.
Oh, wow.
And it was very noticeable at that point. So that's when I decided I need to find someone to help me. And that early process was really frustrating and scary. I went through biopsies, took a long time to get those results back, and my local doctors just all wanted to do surgery. None of them could really understand why I felt so bad because, like I said at the beginning, my thyroid labs were totally normal. And at one point, I did start taking a drug called low dose naltrexone, LDN, and I did see some improvements in how I felt and also in my thyroid labs, which, they were normal, but they did actually improve a little bit. But after only about 3 months of that, my progress pretty much halted because I started an antibiotic for a UTI, and I had an allergic reaction to that antibiotic, and that reaction caused a whole slew of dominoes to fall, if you will. The main one was that it caused my nodule to rapidly double in size. And at that point, I went from having something that was sort of annoying with this lump in my throat to being in immediate need of help. So I had to do something at that point.
I think you touched on a really important point there, Jen. But first, I want to remind our listeners what LDN or low dose naltrexone is. Naltrexone is a medicine we've used for years in addiction medicine, like addiction from drugs and alcohol. But we found in more recent years, low doses of naltrexone or LDN are really great for different autoimmune conditions. There's not a lot of data or research on Hashimoto thyroiditis and LDN in particular, but we can kind of extrapolate what we know from autoimmune diseases towards Hashimoto thyroiditis. So LDN is really great at decreasing inflammation, decreasing antibodies, decreasing neuroinflammation, which is brain fog. And it's really great for the gut too. And that's probably where most of its benefit is. It's very healing to the gut. And the thyroid itself is so sensitive to inflammation. So that inflammatory insult that you were talking about probably did play a huge part in the rapid growth of your thyroid nodule.
I kind of wonder if I had never had that allergic reaction to antibiotics, if I could have just continued on the LDN and maybe very gradually I could have seen improvements with my nodule because I did feel a whole lot better with all of my symptoms on
Yeah,
LDN. I'm a big fan of LDN for people who have autoimmune disease.
it does.
But unfortunately, unfortunately, that was not my path.
Oh. So can you tell us a little?
Jen, it's easy to understand your mission, which is to help patients keep their thyroids whenever possible. Will you share with our audience why you came to choose RFA for yourself? How did it come to your attention? We'll get into the why of RFA that's so important in a few minutes, but can you also talk a little about the process you undertook to find a provider to take your case? There aren't a lot of us around yet.
Um, so after I had this allergic reaction, I was so desperate for relief because I just felt like I was choking all the time. And I would get dizzy for turning my head to the side. I
Oh,
couldn't even lay down to sleep at night because my airway would just close off from the lump being, it was actually deviating my trachea to the side.
wow.
And so at that point, I knew I needed a medical intervention, right? I knew that there was no possibility of me just, changing something in my lifestyle or my diet that was going to intervene to the level of what I needed at that time. And I seriously needed a medical intervention, but I was fully aware that sometimes surgery has unintended consequences.
Oh, that's
And I have personal experience with that, unfortunately. I had a couple of knee surgeries when I was 18 that went horribly wrong, um, resulted in a near fatal post-operative infection that I still suffer consequences from today.
wow.
Um, I'm disabled actually from it, and so I knew that surgery was not something I wanted to go into lightly. And then additionally, I just felt this really strong need to advocate for myself to avoid surgery. Because when I asked my ENT what he would do if I were to have a repeat of this post-operative infection, which I had been told by specialists could be a possibility, um, I asked him, what would you do? And he said, well, just let the infectious disease department handle it. And I
Really?
just felt, yeah, I felt like that was a very casual attitude. And
Yeah.
I wanted someone who would be more proactive, to help me deal with something that, for me had been life altering the first time around. And it had been 20 years since then at this point in time where, I'm older. I know that it's riskier the older you get to undergo surgery and everything gets more difficult as you age. So I just wanted someone who would be more proactive. And I also knew that surgery would possibly leave me needing lifelong thyroid hormone replacement. And unfortunately, I have a pretty consistent track record for being intolerant to medications. So I knew that the need for lifelong medication should be avoided at all costs for me personally. So I knew I needed some alternative to surgery, but I didn't know what it would be. And to be honest with you, I was just up one night and I couldn't sleep. And I was just praying and saying to God, I need help. Help me find some other alternative to surgery. And I discovered RFA. So I was actually scrolling through my phone and I saw this image of a neck on Google image search that said it was a picture of a neck that had a tiny little dot on it, and
Uh-huh.
it said treat thyroid nodules without surgery.
Uh-huh.
And I thought, are you serious? And I clicked on it and it took me to a website for two doctors in Utah that were offering RFA. And I was so excited. I read the whole website and then I sent them an email. And this was like 3 o'clock, 4 o'clock in the morning because I couldn't sleep. By the time my alarm went off at 6 o'clock, I already had an inbox from them.
Oh, wow.
And yes, I could not believe they responded that rapidly. Um, and so that was very exciting, but I was still researching because I didn't know if I could go all the way to Utah where they were located. And so I did some more research through another doctor who I spoke with. I learned about the doctor I actually ended up seeing who was in Virginia, which is quite a bit closer to me. I'm in Huntsville, Alabama. So I ultimately submitted my records, found out I was a candidate, and I sought treatment with a doctor named Dr. Owen Park at the University of Virginia. And at that time, these two locations were the only two treatment centers in the U.S. offering RFA. So it was it was those two choices were your options, and thankfully both choices were great options. But yeah, so I went under 2 treatments of RFA, and all of my choking symptoms have disappeared. My neck has shrunk 3.5 inches.
Wow.
Which is quite a bit for a woman. And over the past 4 years, I've maintained a 90% reduction in the size of my nodule. So needless to say, I'm incredibly grateful to have been able to undergo this procedure that rescued me from a pretty dire situation.
You are so completely right. Because unlike surgical removal, if RFA is a viable treatment for a patient's nodule or nodules, it can target the problem area without also destroying the functional part of the thyroid gland. We want to remind our listeners that most thyroid nodules are completely benign growths of the thyroid. They're generally not cancer, but they do need to be checked out by your healthcare provider. Even when they're not malignant, they can still cause significant trouble in various ways. Like I mentioned, cosmetic concerns, compression on the windpipe, trouble breathing, coughing, swallowing, voice changes. But taking a thyroid out for a nodule doesn't solve the problem. It just trades one problem for another, because we're taking out a fully functioning gland, and the thyroid controls pretty much every aspect of our being. So just taking it out and then just putting someone on thyroid hormone replacement and calling it a day just really isn't always the best approach.
And that's the part of this issue that I had never really heard of. And I know at least one, I think 2, people who have had their thyroids removed. And I'm not sure, I haven't talked with them about it at length, but I'm not sure that they knew all that either. I just don't know. So, Jen, in your podcast, you say that one thing many thyroid patients tell you is that they strongly dislike being told by providers that their only treatment option is surgery. And I imagine that's especially true when other appropriate options exist. I'm so grateful that you're giving patients and medical professionals as well information and resources regarding safe, effective alternatives to surgery.
Definitely.
Jen, you must be so pleased to see your effort grow as it has. It's quite remarkable.
Well, I have to say the work you're doing about spreading information is so important. This procedure is being so patient-driven, because a lot of the patients that I see in the clinic they're here to see me because of the information that you put out on your YouTube channel and on social media. We're trying to get the word out more to physicians, but it's hard. I mean, change is really hard for traditional medicine. So it's really important to get the information out that people know that they have options other than surgery. Are there any recurring questions or concerns that you have come across from your followers in regards to RFA?
Yes. And we try to make sure that whatever the current trending questions are in the community, that we're addressing those. Either we will answer those directly. We have a number of moderators that help manage the community, and they are all patients who've also had RFA, and they will take time to answer their questions directly. Or a lot of the questions, if we're seeing it commonly come up, I will actually address it with a video. And so I'll interview someone and discuss it with them in the podcast.
Well, it's always good to have someone to ask if you have a question in any type of procedure.
Something I saw on Jen's website, that's saveyourthyroid.org, stunned me. I'm paraphrasing this, so Jen, correct me if I get this wrong. Every year in the United States, 150,000 thyroid glands are removed either partially or entirely in a procedure known as thyroidectomy. 2/3 of those thyroid glands, that is 100,000 of them, are removed wholly or in part for benign thyroid disease. I was stunned after reading that, Jen. I totally respect surgeons and have greatly benefited from their skill, and I'm taking nothing away from surgeons here. So I'm assuming that this astonishing number of thyroidectomies is due to surgery being the norm for so long, especially in the absence of other effective treatments. So does removal just seem like the more typical thing to do since it's always been that way in the past, despite us having other options now?
I think it probably does. I think that there's just a normalcy to thyroid surgery, and there's also a normalcy to prescribing thyroid hormone. I mean, I cannot tell you how many patients have told me they went to their doctor because they had a thyroid nodule. Doctor sent them to a surgeon, and the surgeon says, it's no big deal. You just take this pill and you'll be fine.
Yeah, call it a day.
Well, the likelihood is if you're being sent to a surgeon, the recommendation is going to be surgery. Although I completely value our surgical colleagues, but if this is what they do, that's what they're going to recommend. And the surgeon's going to do the surgery. As long as you don't have any complications, that's fine. But he or she is not going to be the one that follows the patient for the rest of their lives. They're just there for the surgery, and they're not replacing the thyroid hormone or following the levels or following up on a patient's quality of life afterwards.
Jen, is it accurate that a nodule might not be completely removed during RFA, but that the volume is greatly reduced with the initial treatment and perhaps with a follow-up or two, with further volume reduction expected post-procedure?
Yes, that is correct. That is so the premise of RFA for benign nodules is that the inside of the nodule will be treated, but there is probably going to be a small remnant around the outside that is still there after the treatment is done. And the reason for that is that it's not necessary to kill all of the thyroid nodule for it to shrink and reduce in size and to reduce the patient's symptoms. Now, when it comes to thyroid cancer, that's a different story because you want to kill all those cancer cells. And so in a thyroid cancer that is ablated, they will actually go outside of the borders of that thyroid nodule to make sure that they've eliminated every last bit of it, and that the goal is for it to completely, reduce to nothing, if not almost nothing. So there's a little bit of a different I guess philosophy might not be the right word, or approach might be better for those two different methods. But the main reason to treat the nodule with thermal ablation or RFA is to reduce it in size, not to get rid of it.
Right.
So, if you, like for myself, like, for example, I have, still a small remnant of my nodule left behind. It'll never completely go away, but you can't see it. And I can't feel it. Yeah. And that's fine by me. That's the goal, was to eliminate those compressive symptoms that I was having. Or if you're someone who has a thyroid nodule that's creating extra hormones, you want to kill all that tissue that's producing that extra hormone. It may not ever completely reduce or go away, but if you stop that hormone production, you've created a better situation for that patient.
And I think you bring up a good point, Jen. For some of these very large nodules, our goal is to just make them smaller and make the patient more comfortable. We're seeing very, very large nodules. I'm talking like in excess of 100 milliliters. So in reality, those people are going to need more than one treatment. Same thing goes for overactive nodules. You have to get those overactive nodules to 80% at least of what their size is in order for them to remain in a normal thyroid state. So thank you for pointing on the fact that some people are going to need more than one treatment.
And I needed more than one treatment for mine just because it was so large. And I was totally fine with that.
And RFA is a valuable treatment option for very small thyroid cancers. So these are called micropapillary cancers. They're like less than a centimeter and a half, because the American Thyroid Association offers observation versus surgery for these small cancers. And that could be really upsetting to a patient, knowing they have cancer and we're just going to watch it. We're going to do an ultrasound every 6 months to a year. We're not doing anything. because it's probably not going to grow. So when we look at long-term studies, these are the patients that eventually end up having thyroidectomy because they're so stressed out about having cancer. But with RFA as an option for these small thyroid cancers, it makes the patient feel, hey, I'm being proactive. I'm doing something about it. And as doctors, we're actually treating or curing the issue.
Are insurance companies consistently paying for RFA yet? And if not, is that surprising to you? Seeing how much money insurance companies, I'm assuming this, I don't know for a fact, but I'm assuming insurance companies would save a lot of money on RFA versus surgery and that lifetime of replacement medications.
Not to mention other possible complications from surgery.
I think it's completely ridiculous that insurance isn't covering this yet.
It's crazy.
Because if they were to do a cost benefit analysis just on the cost between RFA and surgery, they would see that the typical cost of RFA is going to be under $10,000. It's not going to include a hospital stay. It's not going to include general anesthesia. It's not going to require the patient to go on lifelong thyroid medicine, as opposed to surgery where the patient's going to be hospitalized. The hospital stay is going to be a day or maybe even longer. The patient will be on lifelong medication probably. And the cost of all of that, just for the hospital stay alone, is going to be $30,000 to $50,000,
At least,
not including all of the medication that patient will need and all of the follow-ups that patient will need for the rest of their life. So when you just look at the costs alone, insurances should be covering this. It's crazy to me that they're not on a regular basis. And then when you consider the fact that what I'm hearing from the community is that more often the thyroid cancers are being covered, but not benign nodules. That doesn't make sense to me, because I'm like, well, why not cover it for a benign nodule? What's the difference? I don't know, but I think that if we had the ability, and maybe someone who's smarter than me would be able to put this together, but if we had the ability to track the financial aspects of both of these, comparing thyroid RFA to thyroid surgery for the life of the patient, what are the costs that are incurred by the patients on both sides? I think we would see a significantly less amount on the side of non-surgical treatment.
I agree 100%. Not to mention the cost of quality of life.
It's where you're going to be spending, it's not money, but your life is something you can't pay for.
We mentioned your nonprofit that's named Save Your Thyroid. My understanding is that Save Your Thyroid focuses on RFA for thyroid nodules, offering free information, support, and education for both patients and for healthcare providers. Is that correct, Jen? And would you please tell our audience a lot more about Save Your Thyroid, as well as where they can find it and where they can donate if they'd like to do that as well?
Sure, yes. So Save Your Thyroid, or SYT for short, is ultimately an unbiased community and a future nonprofit. We're still working towards that goal of being a fully incorporated nonprofit, but it is mostly just an unbiased community for patients who are seeking these non-surgical treatment options for thyroid cysts, nodules, and cancers. And the reason I say unbiased is that we don't promote any doctor, hospital, institution, or procedure. We just provide resources. We want to educate people so that they can know all of these options and make an educated and informed decision. And so our mission is to prevent unnecessary thyroid surgeries through education by preserving the patient's quality of life for as many patients as possible. The community is a place where patients can find and share resources and testimonials for FDA cleared or approved non-surgical thermal ablation procedures. And these include RFA, or radiofrequency ablation, which we've already talked about, PEI or ETOH, which is for percutaneous ethanol ablation, laser ablation, and microwave ablation, which is kind of a new kid on the block when it comes to thermal ablation in the US, but it's starting to kind of gain popularity. And then there's cryoablation, which we don't know quite as much about, and embolization, which has to do with, making these huge thyroid nodules, actually where it's almost like the neck no longer even exists, reduce in size. And as I said a minute ago, we started this community on Facebook, and that's because they allow us to use their platform for free of charge. We didn't have money at the beginning to put into the effort, so we just used what we had access to. And apparently we weren't wrong, because as I said, we've got over 8,000 members who have been looking for these kinds of resources. And these patients come from everywhere, all over the globe. And our community is run entirely by patients who volunteer their time and their effort to give back to their fellow patients. And Dawn, you talked a minute ago about how the number of thyroid surgeries is so high that 150,000 thyroidectomies annually is only in the US. It's not across the globe. But I think that it is a common issue in other countries as well, because I see messages on not just on Facebook. I have patients reach out to me on YouTube, on other social media who send me private messages or even emails saying they're only being offered surgery. And so, in the US, every day, 274 people lose their thyroid gland. I shudder to think how many people globally are losing their thyroid gland to surgery when they may have been a good candidate for a non-surgical option that would save their thyroid. So I think enough people have witnessed this with their family and their friends go through the decrease in the quality of life, as you said, Dr. Mazza, that they want to find other options. And that's given people a better understanding of just how important the thyroid gland really is. So as our community continues to grow, we hope to serve patients in even greater ways than we already have and collaborate with other organizations like Thyroid Cancer Survivors Association and create better awareness in the physician community as well. But those kinds of projects do require manpower and funding to make them happen. So we're very grateful to have been able to be fiscally sponsored by THICA, the Thyroid Cancer Survivors Association, and that allows us to raise funds to support these efforts. And just by the way, I also would like to say a little plug for the conference that we're going to be doing this coming weekend, in collaboration with THICA, which is going to be, we're actually going to be doing 2 sessions on thermal ablation at this conference with THICA. So, we're going to be talking with experts and patients about their experience with treating thyroid cancer with RFA and these other non-surgical options. If this podcast episode that we're recording right now is aired after that, anyone who wants to watch those sessions can just go to the THICA YouTube channel and watch them because they will be recorded for later viewing. So, because THICA, like I said, is our fiscal sponsor, they are a 501c3 organization already. They can accept tax-deductible donations on our behalf. So all a donor has to do is simply visit thyca.org, that's THYCA.org, click the donate button, make your contribution, and then at the bottom of that page, there's an email address that it says if you have questions, just send an email. You can click on that email address and send an email letting them know that your gift is for Save Your Thyroid or SYT. And, we appreciate donations of any size. No gift is too small. It all goes back to helping all of these patients learn more about how to save their thyroid.
We'll make sure we have all those links in the show notes when we post this. So do I dare say what's on the radar coming up for you now, Jen?
Well, I tend to stay pretty busy these days. So I always have stuff going on. But as you guys mentioned at the beginning, I do have my own podcast, which is all about thyroid nodules, and it's available on YouTube and Spotify. And I'm so grateful for all the opportunities I've had to interview some amazing people about this topic, including you, Dr. Mazza, which was such a pleasure. And I am very, very excited, actually, to be having you on the show again very soon, where we're going to be talking Yes, where we're going to be talking about your new book. I can't wait to read it and talk all about it. And I actually just recently attended the American Thyroid Association meeting in Washington, D.C.
Wow.
and was so excited. Yes, it was so exciting because they actually did their first ever thyroid thermal ablation physician workshop, which I think is a big deal. Isn't that a big deal?
Yes, it's definitely a big deal.
Yeah, it's been 4 years since this has been available in the US and now they're on board with it. So I'm just like, yay, that's so good. So yeah, going to that meeting and going to that training was absolutely incredible because well, first of all, the meeting was at full capacity. I mean, it was like 50 plus doctors were attending. And they did a half a day of lectures and then a half a day of hands-on. So I was really excited just to see the turnout. But also, I met several of the past podcast guests that I had interviewed who I'd never met in person. So yeah, so getting to meet some of these people in person, Dr. Stefano Spiezia from Naples, Italy. I've seen Dr. Ralph Tofano multiple times at these different meetings. I got to meet Dr. Catherine Sinclair from Australia, who's still the only RFA physician down under. So yeah, I got to meet a bunch of really great people and also a few really cool companies that have products that are relevant to thyroid nodules, like genetic testing and some new technology that's on the horizon. So I met some new podcast guests that we'll be having in future episodes, and I can't wait to share all about this in my podcast. So if anyone wants to listen to those episodes, you can subscribe to my YouTube and my Spotify channels. And also, I have a blog on Substack where I share a lot about the same material there. All of those channels are called It's Me, Jen Again.
Okay.
And then additionally, Save Your Thyroid has some great projects on the horizon. One project in particular is we really want to create some educational resources to help educate the primary care community. We think that, letting them know more about these options would help when they're making their referrals to, endocrinologists and ENTs. And, not necessarily that it would mean that they would have to agree with it, but just that they know someone who's doing it and that patient could go and get the right kind of advice. Because we hear so many patients say, oh, well, my doctor never heard of it. He said it was bad.
Right.
So, we want them to get good advice. And then lastly, as you mentioned, our website, saveyourthyroid.org, we maintain a list of the physicians offering non-surgical treatment options. And that list just keeps growing, which is so exciting. We know of about 150 doctors just in the US offering RFA, laser, microwave, and embolization, which is a far cry larger than the 2 that were available back in 2019 when I needed these treatments. So if a patient is looking for a physician who offers these procedures, they can visit the site and find a doctor near them. And what we're hoping to do in the future is offer even more resources on that website. Currently, that most of the resources are only available on the Facebook community, which is just for patients at this time. But for anyone, physicians included, who want information from the website, they can visit saveyourthyroid.org, or if they want to speak to me directly, they can email me at saveyourthyroid@gmail.com. So that's that, and so much more is going on, but I probably don't want to talk your ear off. But lots of stuff is happening. It's exciting, and I'm so grateful to be a part of it, and grateful for what I'm seeing happening with our patients and what I'm seeing in the physician community as well.
Jen, thank you so much, not only for the life-saving work you do, but for making it so accessible to the people who need to learn about this important option. Jen, if you'll email your preferred contact info and various links, we'll be sure to include that in the show notes.
Sure. I actually have a link tree that has every single one of my links in it that I can share with you
Great.
to
Perfect.
put in the show notes. So thank you.
Okay.
It's me, Jen, again as well.
Good. That's
You're
great.
consistent, Jen.
I just know how I felt when I was going through it, and I don't want anyone else to go through that. And so that's what drives us to help these other patients, help your fellow man. So thank you so much for having me as a guest on the podcast. I'm really grateful for this opportunity to get to see you again, Dr. Mazza, to meet you, Dawn. It's just been really fun. And I'm really grateful for the work that you're doing to educate thyroid patients, not just about RFA, but about all things thyroid. So you're doing a really, really great job, and I'm super proud of you with your podcast. So keep up the good work.
Well, it has been such a delight to speak with you today. I just can't thank you enough for sharing this absolutely crucial information with our listeners. I'd also like to add that I'm honored to be a guest on Jen's podcast, like she mentioned, coming up very soon. We'll keep you posted on the exact date that'll be aired. Well, I wanted to do this podcast to provide life-saving education and to encourage folks to see a doctor in time to prevent or minimize damage. It's deeply fulfilling. I really enjoy helping folks understand how all aspects of their lives are tied to both thyroid and overall health. As always, my goal is to help us live more fulfilling lives by taking control of our health and thus feel our best. In fact, that's why I went into endocrinology. It's a medical art that combines science with the study of our lives and all that they encompass. Well, we haven't 100% decided yet, but I think that our next episode we're going to cover unprocessed, processed, ultra-processed foods, and the inflammatory process. You'll have to listen to find out.
And as always, we hope our listeners will continue listening to Thyroid Talk with Dr. Angela Mazza. We have many more interesting episodes and guests planned. We'll build on today's foundation and cover many topics we hope you'll find meaningful. So now to recap just some of what we covered in this episode, not necessarily in this order. Jennifer Holkem's mission, education for patients and providers, helping everyone learn about non-surgical options for thyroid nodule treatment. Why having safe, effective alternatives to thyroid removal is so great for many patients. Jen's thyroid journey and why she chose RFA for herself. Her podcast, Save Your Thyroid with Jennifer Holkem. And Jen's nonprofit, Save Your Thyroid, or SYT. And best of all, we learned that we can impact our thyroid health. Listeners can also reference a previous show on Thyroid Talk with Dr. Angela Mazza, which is Thyroid Nodules 101, an Intro to RFA. That's episode number 4, dated March 18th, 2022. As Dr. Mazza mentioned in our next episode, number 23, we hope to cover, and we're working on unprocessed. It's in process. There's a lot of processes here. Unprocessed, processed, and so-called ultra-processed foods, and the inflammatory process. Mm-hmm. We'll see how that goes. We might have a surprise topic instead. No promises. No.
Due to the process.
Yeah, it's quite a process. For information on at least some of the supplements we may discuss on this show, please visit the Wellness Store at metaboliccenterforwellness.com.
Full disclosure, I personally use and I carry supplements by Douglas Laboratories and Pure Encapsulations in both my office and at our online site.
And please watch for Dr. Mazza's book, Thyroid Talk, an integrative guide to optimal thyroid health. We're thrilled to announce that it's actually been released as of October 11th. Isn't that correct?
Yes.
October 11th, 2023 on Amazon. So please look for it there. And plus, there is an online master course related to the book to help guide you to optimal thyroid health.
The online course will help you walk the talk to energize your life. The masterclass will have modules that cover topics like diagnosis of thyroid issues, personalized treatment, gut healing. That's one of your favorites.
I almost said something, but I refrained.
And much more, plus some bonuses. And the webinar will coordinate with the online masterclass. And yes, I am so happy to say that we have been released on Amazon by the time that you hear this recording today.
Awesome. I'm really happy about that. And it's a great asset for thyroid patients and providers. I know that personally because I've seen some of it and, getting through it.
You're privy.
I was. I'm very lucky.
So please stay in touch. Check out the YouTube channel, the website at Metabolic Center for Wellness, as well as Facebook, Instagram, and TikTok. And I do not dance on TikTok.
Oh, now you're going to try to make me laugh again. I'm going to resist. I'm going to try to get through this without laughing. We welcome your input. See, now you got me. Endocrinologist dance. I don't know. Don't know what that is. Please submit your questions, comments, and show ideas to thyroidtalk.mazza@gmail.com. That's an email address. She's still trying to make me laugh. We may disclose your general location on air, the city or town, for example, but we will not read your name nor your address on the show. We reserve the right to edit your input as necessary. And please don't forget to ask your healthcare provider any specific questions regarding your wellness. This podcast is meant for educational purposes only.